Hello, I'm Dr. Victoria Titterington. I'm on the faculty in the College of Criminal Justice at Sam Houston State University. I teach in our Victim Studies program, and I also work alongside our Law Enforcement Management Institute. Today I'm going to be talking with you about law enforcement and older adults. This is part one of a two-part module, and this first part is about basics of aging. We'd like to first acknowledge the Human Resources Services Administration for this grant that has funded this video education library that you're participating in at this time. So for this module, this part one, what we're going to do is at the completion of this, I expect that you'll be able to provide a profile of aging in 21st century America. And we're talking here primarily about community dwelling elders, as these are the living arrangements of the vast majority of older people in our society today. You'll also be able to list some of the typical physical and psychological changes in aging, as well as some of the social changes that come with becoming older. And finally, the final objective for this module is that you'll be able to give examples of the unique role of law enforcement with older persons. So first, let's look at a profile of aging in 21st century America. I thought we'd start off with 5 common myths or misconceptions about older Americans and sort of lay some groundwork with that. One of the most popular misconceptions is that most older adults live in nursing homes. What we know, in fact, is that less than 5% of all older adults live in nursing homes, though the chance increases with age. But presently, there are only about 2 million people in such facilities across the United States. It's also commonly believed that older men and women are equally likely to be widowed. But in fact, what we know, and we'll talk about this later in this module, is that there's a much greater likelihood of women spending their older age as widows than there is for men. And as I said, we'll discuss why in just a bit. It's also thought by many people that most older people live in poverty. Well, historically, that was actually true. In fact, before the Social Security Administration was created and Social Security became a public entitlement program, it was the case that many, many more older people lived in poverty. That is no longer the case. However, what we know is that probably as many as 40% more older people would live in poverty were it not for Social Security. Many people have the misconception that most older people suffer from dementia. Well, once again, with advancing age, the prospects of that happening do increase. However, it's not the case that the vast majority suffer from dementia, nor is it a necessary development in older age. It happens for some, but by no means all older people. And finally, without thinking about it, a lot of us think all older people are about the same. Well, in fact, what's true about this age group is that it's more variable than any other age segment of our population. There can be vast differences between a 65-year-old and an 85 or 90-year-old, and not always with the case that the 65-year-old is healthier and the older person is not. It could be just the opposite. But the point is there's a great deal of variability, and we'll talk a bit more about that as we move forward. Okay, let's look first of all at population trends in the United States to illustrate the fact that the older segment of our population is definitely increasing. What we know is that in the beginning of the 20th century in 1900, less than 5% of all Americans were over the age of 65. What happened if we fast forward 100 years is that 13% of the population is in this age segment. And in fact, by 2030, the projection is that it'll be about 20% of Americans will be over 65. Right now, it's about 14%. And again, moving forward just a bit further, by 2040, the 85 and older population will quadruple in size to nearly 14 million. So I've given you three graphs here taken from the U.S. Census Bureau simply to illustrate what the age structure of the overall population has been and is and will be in the future. And this first chart shows us the population pyramid, as it's so called, which clearly illustrates that at the bottom, the widest bars, which mean that there are many more people being born, and at the top, really short bars, meaning that there are relatively few of us who are in this older age category. Even if you look from 65 forward, you can see that there's a much narrowing, which means that people are many more being born, slower rates of dying, longer life expectancies have not yet really arrived. Then if we move forward to 2000, what we see is that this pyramid is slowly morphing into a different shape. And if you look, for example, at the age bars that illustrate the ages of 35 on up to even 75, what you can see is that they're much wider. That means that relative to the number of new births, life expectancy is increasing, and we have an increasingly larger proportion of our population that are getting into middle years. This actually illustrates this particular chart, the baby boomers as they're moving out of teenage years into young adulthood and then middle age. And then if we fast forward to this third chart, what we see is the projections for the age pyramid in 2050. And it's almost become from a triangle almost into a rectangle. So again, virtually as many people in the 65 and older age category as there were in the middle age category, and much less difference between the proportion of our population that are younger and those who are older. This is simply another way of depicting that same thing, and in fact what it shows us is the age trend, the trend in the population age 65 and over, which is the top blue line, and then you can see below that, but also increasing at a relatively fast rate, are those age 85 and older, and this is going from 2010 projecting into 2050. So that growth is really increasing for both, and particularly it's noted that we have an increasingly larger proportion of our population who are 85 and over. I also thought you might find another way of measuring population aging that would be interesting, and that is something that's called the dependency ratio. And basically this is one of the consequences of an older population. And dependency ratios basically provide a way to examine the changing age structure of the younger as well as older populations. It's an indicator. The reason it's of concern for us is that it is an indicator of the potential burden of the dependent population, meaning those younger and those older, to those who are in the age range of 18 to 65. This 18 to 65 age range of U.S. adults is thought to be the years that you're working, paying taxes, and ostensibly also the years that you would be available to take care of someone. You're either taking care of young children or you're taking care of older people. So one of the concerns is that this is going to generate an increased demand for elder health care and housing, again at the burden of the working taxpayer. There's also, with that, fewer workers to pay Social Security taxes. There's also concern that this represents a change in the number of people able-bodied who would either be raising young children or would be taking care of older people. So you can see that the top lavender segment of these bars represents the old age dependency, and in turn what you note is that the turquoise represents younger people. So what is happening is that we now, as of 2008, we have a child dependency ratio of 44 and an elderly dependency ratio of 25. So there's a total dependency ratio of 65 just for that 1 year. And again, this simply illustrates to you how there is an increasing demand, if you will, for caregiving and also tax paying on a relatively smaller proportion of our population. So let's talk for a few minutes about some of the physical changes with aging. Some key concepts that I thought you would find interesting in your line of work. You hear some of these terms or you're somewhat familiar with them, but I thought we would list them for you just to sort of give you a better foundation in what they actually mean. And of course, geriatric is the first one that comes to mind. It simply means, in the Greek derivative, it simply means old man, just as elder simply means someone older than someone else. And historically, that meant someone in a position of power or authority. We hear all the time people throw around the term senile. Well, she's getting senile or he's getting senile. And it's actually derived from the word senescence, which means literally the increased vulnerability to stress and an increased probability of death. And then, of course, ageism, not unlike racism or sexism, is simply a systematic stereotyping, in this case, based on the fact that people are old. And the danger we have to beware of is that ageism includes patronizing people where we think we're being nice to them because they're older, but really it's in a sense not as respectful as we might be. And similarly, infantilizing, and especially as people get older, a lot of us are guilty of treating them as though they're infants, as though they're children again, whereas there are really some important differences between those two age groups. So some other concepts that we wanted to share with you: morbidity, which simply means illness or death, and then mortality, which is literally a fatal outcome. And if you go to the CDC, the Centers for Disease Control, for example, you could see regular reports called morbidity and mortality reports, and it shows us year by year, even month by month, what is happening in terms of our U.S. population. What kinds of things are people ill from? What kinds of things are people dying from? When we talk about the lifespan, that's literally the longest number of years a given species is thought to have lived, and in the case of human beings, for example, it's well over 100. By contrast, though, life expectancy is the average number of years a certain species will live, and we'll look in just a few minutes at what those life expectancies are like right now for older adults in our population. Active life expectancy is a little different term, and that simply means the number of years that you live without disability. It's somewhat different for men and women, and again, we'll look at that momentarily. And then finally, octogenarian, simply someone who's lived into their 80s, and as I've said before, we have an increasingly larger proportion of our population to whom that applies, and centenarian, a person who lives to age 100 or beyond. So this is simply to show you, in some ways, sort of define what many people think. What are the 10 leading causes of death by age group in the U.S. as of 2013? And what we know is that clearly for older people, the likelihood of dying from cancer, heart disease, diabetes, and so forth are the major players in their case. But you can look at this and find it kind of interesting for all age categories. What are the main ways that people are actually dying in those relative age groups? Now, as I said just then, in looking at that mortality table, what we know is that the vast majority of older people are dying from chronic diseases, but that hasn't always been the case. And this also is part of why our population, the proportion of our older population, is increasing. Because historically, and this is true in virtually all countries, now we're way past that in the Western world, but historically, people die from famine or pestilence. And we know that presently there are third world countries where that is still the case. People don't live very long because of diseases that come with those conditions. And then we move to a period, has been true in the U.S., where people are no longer dying from famine or pestilence. For example, we developed the ability to keep our water supply clean, and that made a vast difference in the overall health of the population. So then people begin to die more, or are more likely to be living past those initial threats and dying instead from infectious diseases. But along come vaccines, and largely as a result of vaccines, as well as general public health, What happens now is that most of us literally live long enough that rather than dying from these causes in the past, we're dying from chronic diseases of old age. So that means that these aging dependent diseases are actually what increase our risk of death, and I've listed some of these for you, including heart disease, chronic respiratory disease, and Alzheimer's disease. And so again, we thought you would find it interesting to see that at age 65 presently, women on average are going to live an additional 20 years, whereas men will live an additional 17 years, again, on average. What's true, however, is that women will live a little over 13 of those years in good health and another 6 to 7 years dependent on others. And in comparison, what we see is that men will live those remaining 17 years on average, a little over 11 of those years in good health, and somewhere between 5 and 6 years dependent on other people. So in both cases, the prospects are good for most of that time, but again, we live long enough that we are likely to, at some point in the late stages of our life, become dependent on other people. So what are some of the physical changes with age, some specific ones? As we look at these, one of the things you want to keep in mind is that genetics have a big influence on our rate of aging. Some are thought to say that genetics are 35 to 40% of the predictor of how well and how long we'll live, whereas lifestyle factors, this includes exercise, diet, smoking, alcohol use, those sorts of things, account for environmental influences as well, account for the additional ways that we age, how long we live, and how well we live. So if we look at chronological age, we're saying, how long have you been alive, as opposed to biological age? How old is your body? And that means how old is it physically, or how old is it psychologically? And we'll just go through these one at a time. One of the things certainly for law enforcement professionals to be aware of are some of these physical changes, because what we think they suggest are precautions to take in your work when you are interacting with older adults, as well as potentially questions to ask. So in terms of our skin, what we know is it does, as we get older, it becomes thinner, it bruises more easily, and medications may also increase bleeding. But just among many precautions or questions to ask for law enforcement include realizing that skin may tear more easily, so you may actually respond to a scene or a call for service that involves an elderly person and be pressed into service to help control bleeding. It's also very important to be careful if you need to have any physical contact with them, that their skin, be aware that it is so sensitive. It's harder for older people to stay warm, so in sizing up a scene that you may be responding to, one of the things you want to ask yourself is this person dressed appropriately for the ambient temperature? Is it really hot, but they're dressed in layers and layers, or it's really cold and they're simply sitting there in a nightgown, for example? They're also very susceptible to bed sores, and some of the advice is that at a minimum, and of course this depends on the medical experts involved in their care, that they need to be turned or moved every 2 hours, and that may be something that becomes part of the questioning if you're in a situation where you suspect there may be some sort of abuse or neglect. In terms of bones and muscles, obviously we know that older people's bones begin to thin, become more fragile. Osteoporosis sets in, more so for women than men, but it actually can affect either gender. And the stooped posture becomes apparent. Muscle mass decreases. In fact, there's one estimate that it decreases by as much as 30% by the time someone reaches 80 years old. Less fatty body tissue to keep them warm or to regulate their temperature, and it makes them very susceptible to falls, as well as the prospect of developing arthritis, which of course can become very debilitating and can also compromise their ability to defend themselves in the case of conflict. So precautions to take or questions to ask include being careful to move the person, both in terms of their skin condition as well as how fragile their bones may be, And you want to ask yourself, if this person needs assistance with walking, is there a walker available to them? Do they have a cane? Is there a wheelchair that they can actually reach to get into or get in and out of? Lungs also change with age, and among the things that become more difficult are activities of daily living, which we'll talk about in just a few minutes. Shortness of breath, respiratory infections can become much more serious for older people, develop into pneumonia or chronic pneumonia, and COPD is very common among this older age group. So one of the things that you want to be sure to think about if you're responding to an older adult is to see whether or not the medications they need are available, and if you're in a position that you're transporting them or EMS is transporting them, you want to make sure that those medications stay with them. It's also important if you're interacting with an older person, especially in what is suspected as a criminal incident, invariably you're going to be talking with them and questioning them, and it's important for law enforcement to realize that stress itself can often worsen respiratory conditions. So it's not to say don't question them, it's just to be aware that in fact their respiratory issues may become exacerbated by way of that conversation. The nervous system changes, and by this we include the fact that brain cells die and aren't replaced. The brain size actually decreases by about 30% as we get older, and the likelihood of falls increases. It's also related to this, important to know that apparent fatigue or even nausea may be signs that there's been some sort of brain trauma. So if the person's been assaulted, that head trauma may not be immediately apparent, but it's good for you to suspect whether that's the case, and if so, then certainly you want to get EMS involved. The senses change. The ones we think about probably most include compromised vision, needing glasses, many people saying from age 40 forward, but again, it's not inevitable that a person's vision will be impaired as they get older, but it's very likely, and the same is true for hearing loss. As it relates to hearing loss and using hearing aids, for example, or even just that sense in older people, high-pitched sounds become harder to hear, so it's really important if you're talking with an elder to speak in a lower voice tone, and also be aware that they have probably got a little less sense of taste or smell or touch. Those become compromised, and they may actually be malnourished because they don't smell or taste as well as they used to, and consequently quit eating. So these are just telltale signs that there may be something amiss that you want to be aware of when you're interacting with these older persons. Also, just a reminder that along with a low voice tone, it's often best to talk to older people at about 120 to 130 words per minute. And you can easily practice and find out whether you do that naturally or whether that's going to take you actually slowing your speech down somewhat when you're interacting with them. The heart, of course, no surprise, changes radically. It accounts for a lot of the chronic diseases that we were talking about earlier. And as a result of that, certainly if an elder is short of breath, EMS may need to be called to the scene. You also want to be sure to look for signs that the person is having a stroke. And if you respond to a scene that involves an older person and you think there may be some coronary dysfunction going on or a stroke of some kind, one of the things that you might consider doing is trying to get as much recent medical history as possible while you're awaiting EMS, just to make their job move that much more quickly when they do respond to that emergency. So let's talk now just for a moment about some psychological changes that also typically or may accompany old age. One of the things we distinguish is between learning and memory, and this is simply to make the point with you that learning is the process of getting new knowledge and skill. Memory, by contrast, is the retention or storage of that knowledge. And what we know is that short-term memory, a limited capacity system, It keeps memory in consciousness, whereas long-term memory is the permanent storage site for past experiences. And research indicates to us, as well as probably your own personal experience in interacting with many older people, is that short-term memory seems to be affected more than long-term memory with age. Dementia is one of a trio of psychological disorders that we're most concerned about in terms of older people in today's society. And in a global sense, it simply means a progressive global deterioration of cognitive ability in multiple domains, which affects at least, along with memory, at least one of the following, including orientation to time and place, for example, the ability to learn new things, the ability to understand comprehension or judgment. So if memory and three of those other possibilities exist, then those are signs that a medical professional may ultimately do an assessment that renders that that person is dealing with dementia. And we have what we show here, the dementia umbrella. It's to make sure that you understand that this is a global term and that also the sources of dementia are quite varied, as is indicated in this slide. Unfortunately, the ones that we know the most about, the ones we hear the most about, are potentially because they're irreversible. And of course, Alzheimer's is the major player in terms of the sources of irreversible dementia. But it's also important to know that, as we've shown on the right side of this slide, that sometimes someone can be what appears to be demented as a result of depression, malnutrition, even a vitamin B12 deficiency. And if those situations are sufficiently rectified, then their cognitive capacity may resume close to what it was before. In the case of dementia specifically, what we know is that somewhere around 5 million persons in the U.S. have that at this time. It's thought to increase dramatically with age, and that the prevalence doubles every 5 years after age 65, so that by the time a person reaches 85 years of age or older, roughly 50% of the population is thought to suffer with dementia at this point in time. And as I mentioned earlier, Alzheimer's disease clearly accounts for most of that, somewhere between 60 and 80% of all dementias that we know about in our current time period. Another one that bears mentioning is depression. And these are simply some symptoms of that depression. Someone who's lost appetite, lost interest in favorite activities, is always in a down mood. It often seriously disturbs someone's ability to sleep. They either don't sleep enough or they sleep too much. Difficulties concentrating, of course, one serious concern. Talk about suicide, and it can even affect psychomotor functioning. People at the highest level are actually those 80 and older. Some of the highest suicide rates in our population in general occur with much, much older males, for example. And many times it is a result of poor health, lower economic status, or minimal interaction with other people. One of the dangers as it relates to elder abuse that we'll be talking about in part 2 of this series is that it may make them less concerned or even less aware of abuse that is occurring to them. And by that I mean abuse or neglect or exploitation of one kind or another. Delirium is another syndrome that we wanted to mention, and that's simply to say that it's characterized by disturbances in consciousness. It may occur over a very short period of time. It fluctuates over the course of a day in many cases, and some think of it almost as a fever. It's different from dementia in that it's more acute and it fluctuates again over time. And there are other modules in this video education library that go into much more detail about that. I encourage you to take a look at those so that you can become even better educated about this particular psychological condition. Some questions you might ask if you suspect that there is an issue with delirium? Has there been a sudden change in their mental status? Did the abnormal behavior change during the day? Are they having trouble focusing attention, for example, being easily distracted or being extremely disorganized or incoherent in the way they seem to be thinking? Are they alert or, in fact, hyperactive, or just the opposite, lethargic or in a stupor? Again, these are all signs that EMS needs to get involved as soon as possible. And it's important in pulling together all of these various conditions that may occur with older adults, and often do, that as a result of these, they frequently experience difficulties with what we call ADLs and IADLs, and I'll talk with you just for a moment about what that refers to. But there's signs that for law enforcement that any or all of the conditions that we've just described may make older persons more vulnerable to abuse or neglect or exploitation. So what do we mean by activities of daily living? Well, those are the basics that include being able to feed oneself, taking care of toileting, knowing how to get dressed, staying properly groomed, maintaining continence, putting on clothes, bathing, and walking or transferring. So you can almost think of these as things that we expect people to learn as children and to develop the ability to do, and then continue to be able to carry these activities out throughout our lifetime in order to stay well and healthy. And taking it a step further, instrumental activities of daily living include things like managing finances, handling transportation, being able to shop or prepare meals, being able to use a telephone or other communication devices, managing medications, and housework. So what often happens is that these become compromised sooner than the ability to feed oneself. So for example, one of the things that we know, and research is telling us more all the time, is that one of the first IADLs that may be compromised as we get much older, and particularly if we are developing any kind of cognitive impairment, is the ability to manage our finances. So you may investigate cases or see cases even in your own family where an elder needs help with paying the bills and so forth, but they're still able to dress themselves, feed themselves, and so forth. So it doesn't always occur sequentially, but often these IADLs show up as areas where others need to assist the older adult than the ADLs. And in both cases, as I've said, our concern is that compromises in any of these abilities may make people more susceptible to abuse. So we want to spend just a few minutes with you in this module talking about law enforcement and Alzheimer's disease, because this is, from our research and from our interaction with professionals on an ongoing basis, this is one of the biggest concerns that law enforcement actually has. And what the Alzheimer's organization has done is they've actually, out of their safety services division, they've actually developed some very specific guidelines for law enforcement specifically. So we're sharing those with you in this part of our program. And that includes the fact that 6 out of 10 people with Alzheimer's will wander. Police officers tell me all the time, this is the single biggest concern they have, is that they just pick someone up on the side of the road and the person seems disoriented to where they are, or perhaps even who they are or where they live. We know that it's a really important issue because if they're not found within 24 hours, up to half of them, according to current research, up to half of those who wander will actually risk serious injury, if not death. Disturbing but true is research that tells us that a firearm can be found in 6 out of 10 homes that have a family member with Alzheimer's, and in 45% of those homes, the report was that that gun was actually loaded. So what are the common encounters with people with Alzheimer's that you and law enforcement are likely to have? Well, it could be any one of these that we've listed for you, including auto accidents, driving erratically, perhaps false reports and victimization, indecent exposure, or shoplifting, and certainly suicide and homicide. All of these are places where you may be called to service and be dealing with an older adult who is suffering with Alzheimer's. So quick responses. First, suggested responses by the Alzheimer's Association when a person with dementia is reported missing, and that includes, of course, beginning a search and rescue immediately, searching the immediate vicinity, knowing that 94% of these folks are found within 1.5 miles of where they disappeared. Look around the landscape for trouble spots, like if they're not found immediately, look around for landscape trouble spots like ponds, tree lines, fence lines. About 1/3 are found within brush or briars. Also, use information from previous wandering episodes or other repetitive patterns to point to where would they most likely be. So if this is not the first time that this person suffering with Alzheimer's has wandered, where were they found the last time or the last 2 times that this happened? And then, of course, use media broadcast, and the Silver Alert system is set up in most states to provide for that kind of announcement when it has been approved by the family. And from state to state, the requirements for how the Silver Alert system is deployed vary, but you can see from your own respective jurisdiction what the requirements are. And then contact safe return is a final suggestion in terms of when this person is initially reported missing. Now, if you're actually encountering a person with Alzheimer's, one of the first things you want to do is you want to identify yourself as a law enforcement officer and explain why you've approached them. Maintain good eye contact with them. Speak slowly in a non-threatening, low-pitched voice. Make a point of using short, simple words, and to the extent that you can, ask them yes and no questions. Ask one question at a time, allowing plenty of time for response. And as is often the case, if it's necessary, repeat your question using the exact wording. Often people with dementia can only grasp one part of a question at a time. And if necessary, instead of speaking, if comprehension of what you're saying isn't working, you may try using nonverbal communication. And then finally, as it relates to dementia or Alzheimer's in particular, you want to check for whether or not they have a bracelet, a pendant, or a keychain, as these that are shown here, or a wallet card or clothing label that bears the person's safe return ID number and the emergency 800 number. And the Alzheimer's Association encourages law enforcement, when they are encountering someone with Alzheimer's disease, to notify the family of this safe return program if they're not already aware of it, so that the person can readily be identified if this sort of situation presents itself in the future. All right, so we've talked some about physical changes with aging, some psychological changes with aging. Let's also talk just for a few minutes about some social changes that come with becoming an older adult. What we know is that we've depicted on this slide the 3 generations that you're most likely to interact with who are already in this older age category or are fast approaching it in the case of baby boomers. And what we know is that the oldest old citizens in your particular community are actually what we call the swing generation, those born between 1900 and 1926. So of course at this point in time, these could be very old individuals, but they're children of the World War I generation. I've listed some other characteristics of this particular age group. Very frugal with their money and things, may have in fact, depending on how early they were born, may have in fact been soldiers in World War II. They tend to, for that reason, have married for life, maybe a little more mature after getting out of military service, for example, and they tend to be loyal and trusting. And this is one of the real problems, for example, in their susceptibility to fraud and schemes, financial exploitation of all kinds, is they grew up in an era where you could trust what people said to you, and they're less likely to be suspicious of criminals who are preying on them. The silent generation, or those born between 1927 and 45, and as opposed to World War II, those in this generation who served in the military were likely to be involved in the Korean and Vietnam Wars. They married, not unlike the previous generation, married for life. They're very disciplined and self-sacrificing as a group. And in their mind, retirement has been for resting and for relaxing. And then we move to the baby boomers, who are the group of our population who are now moving into this 65 and older age category at the rate of about 10,000 a day, by the way. And these really fall into, baby boomers are a much more diversified generation than the previous two, in that some were revolutionaries, some were staunch conservatives, some believed that war was a necessary evil, some thought that was the worst thing that could happen. They grew up or developed in early adulthood and middle age using credit a lot, and this, as you know, in law enforcement has presented a whole array of difficulties. This was the generation where many more women began working outside the home, but it's also the generation where divorce became more acceptable, and we'll talk about some of the implications of that in just a moment. They expected a lot from themselves when they were growing up, and also a lot from other people. Not just then, but the same thing is true now, as is illustrated in this placard that she's holding about defending Medicare and Social Security. So the socioeconomic status. What we know is that it's strongly influenced by education. A good education accrues to a good work history. A good work history accrues to greater socioeconomic stability. And we also know that these same status, socioeconomic status, influences over a lifetime, over someone's childhood all the way through their old age, their lifelong access or use of medical services, their actual relative risk for certain diseases, and certainly their economic security in old age. And this, as I alluded to in the early part of this program, the inequality among people 65 and older is actually highest of all the age groups, so that you never want to assume that they're all poorly educated, nor that they're all well educated, that they're all poor, nor that they're all well off. There's a tremendous range of variability, in part just because the sheer number of people that we're referring to. Marital status. In 2007, what we know is that about almost 80% of men in the 65 to 74 age category were married. Compare that to just over half of the women in that same age group. We also know that even in the oldest old category, and by that we're talking about people over the age of 85, the majority of the men in that age category are married. Women aged 65 and older, 3 times as likely as men of that same age to be widowed. And in 2007, we saw that 76% of the very oldest old of women in that over age 85 category were widowed, compared to only a third of the men. So this has lots of implications of who's out there, who's living alone, who may be potentially more vulnerable to elder abuse, neglect, or exploitation. Living arrangements have certainly changed over time, and echoing in some ways what we said about marital status, what we know is that in 2007, 73% of older men lived with their spouse. Only 42% of older women did so. And older women were 2 times as likely as older men to live alone. But we also want to point out, and I haven't made this point earlier, but we want to make it at this point, and that is that just as there's a lot of variability in socioeconomic status and health conditions among older people, there's also variability depending on the race or ethnicity of the individual, and that includes the living arrangements of these persons, so that older Black or Asian or Hispanic women were more likely, when this research was conducted and reported on, were more likely than non-Hispanic white women to live with relatives other than a spouse, so that sense of an extended family under one roof. Also, older non-Hispanic white women and Black women were more likely than women of other races to live alone. So in both of those two race ethnicity categories, about 40% of these older women were actually living by themselves. And then finally, older Hispanic men more likely than men of the other races and ethnicities to live with relatives other than a spouse. So who are the caregivers of these older persons? Again, it's not inevitable that an older person's going to need a caregiver, but to the extent that they do, who are these individuals? And this is where the issue of divorce rates comes in. With higher divorce rates and with smaller families, we also have what we know as blended families. So the people that may be pressed into service or feel a certain obligation to take care of their elders include spouses or children or grandchildren, but sibling responsibility issues have been researched and are some cause for concern. And what Kaneda found in a study at the University of Western Ontario is that in her study, 43% of U.S. families included one child who had all of the caretaking responsibilities, and in only 2% of those families was that responsibility shared. The concern, of course, is that when we talk about caregiver stress and those sorts of things in part 2 of this program, the concern is that one person has too much responsibility, may either physically or psychologically really be overburdened with that responsibility, and also bear a certain amount of resentment if that responsibility is not shared with sisters or brothers. And then, of course, we also know in some cases, friends or neighbors, formal or informal, may be involved in elder caregiving, as well as, in many cases, professional paid caregivers. So just some additional considerations about older persons that you come in contact with your law enforcement work. Often these folks are seen as less important rather than being revered, and we have this idea that in the old days we respected our elders much more and we actually revered older adults as being wise. In fact, in many families that is still the case, and in many other cultures that is still the case. But all too often and increasingly what we see is they actually feel less important than they've ever felt before. And whereas one of the things that makes life worth living is a sense of purpose and identity, we're actually, without intending for that to be a consequence, we're actually, encouraging older people to end their work lives, retire, and often this can really be an issue, a negative problem for them. They actually may gradually lose or actually relinquish financial power. And what's one of the main differences we want to point out to you between older people and children is that in the case of older adults, the families don't actually have any legal requirement to care for them except in cases of guardianship. So that it's really important to realize that you may experience scenes of abuse or neglect and want the family to get involved, and all too often the family, as we'll see in our next segment, all too often the family is actually at the root of the problem. So their own rights and wishes should be respected unless they've been judged to lack mental capacity, and that's sort of the overarching point of these considerations for you as law enforcement professionals interacting with these older adults. So in your jurisdiction, just some final thoughts, we want you to think about the fact, as I've said before, that there's more variability in this age group than any other. You can have a physically and mentally fit 87-year-old, and you can have a really frail and demented 70-year-old, and you really have to take each person individually to see what they're like, what their needs are, and how you can best respond to them. We also know in terms of whether they fear the police, whether they respect the police, or whether they have animosity toward the police may also vary greatly by cultural and racial and ethnic differences. And I think you know that all too well from law enforcement work with any age group, but it's also true in terms of the elderly. And the advice would be in diverse neighborhoods particularly, knowing your elder citizen base becomes really important, including how do they perceive themselves and how they perceive law enforcement. So what's next? Well, in part two of this two-part program, what we're going to do is we're going to move from these basics of aging to actually talking about defining elder abuse, neglect, and exploitation. We're going to describe some of the risk factors for elder abuse victimization and abuse perpetration. Also explain some basic steps that law enforcement can take to detect and investigate elder abuse, and finally give some examples of steps law enforcement can take to strengthen prosecution of elder abuse cases. So we hope you'll take advantage of that additional module. And we also want to encourage you to learn more from the balance of the video education library, and we've listed some of the other modules that are in that library that may be of interest to you. We also, of course, know that beyond furthering your education about elders and elder abuse, you have opportunities for other professional law enforcement development, and we encourage you to check at your regional and state levels with agencies like the Bill Blackwood Law Enforcement Management Institute of Texas as just one example of where you can get a wealth of continued professional development opportunities. Thank you, and we'll look forward to visiting with you in part two.